The impactful study that was presented at the GI ASCO was a trial called a HIMALAYA study. So this was a trial done in first-line setting in HCC, combining Tremelimumab plus Durva versus TKI Sorafenib. And there was also a third arm of a single agent PD-L1 agent with Durva. So the the primary endpoint of this trial was on overall survival. So the concept of this is trying to combine whether combining PD-L1 or PD-1 plus CTLA-4 is better than TKI alone. As you know, the current standard at this time is combining bevacizumab plus a checkpoint inhibitor that was presented 2 years ago that we are using at this time. So this trial was overall, the primary endpoint was overall survival, and it did meet its endpoint of overall survival. The combination of a Durva plus Tremi was superior to Sorafenib alone by a couple of months. And also there was an improvement in response rate along with improvement in PFS. Now, there are a couple of interesting study about this, about the HIMALAYA study was that the single arm of Durva was also found to be non-inferior to Sorafenib. So if you just look at the number by itself, once again, the number itself, the number of Durva seems to be better than Sorafenib in terms of overall survival, the response rate, and in terms of PFS. So clearly, that was another interesting point that where now Durva seems to be to have a not inferior to Sorafenib, but at least trended towards better benefit. And once again, that's a very common theme of all the immunotherapies that the Durva plus Tremi, even though once again median survival was a couple months better than the arm of Sorafenib, the long-term survival, the 3-year survival OS was definitely favored the arm of the combination. Now, having said that, so how does that change our current standard practice at this time? As I mentioned to you, the standard first line currently at this time is atezolizumab plus bevacizumab, based on the trial that was presented 2 years ago. Now, is that going to supplant that combination, with Durva and Tremi? Well, once again, there's no head-to-head study, right? So, we don't want to compare apples and oranges here. Having said that, I think, most of the oncologists would say there is a role for this combination. At least in my practice, I would say that especially in patients who are not a candidate for bevacizumab, they're patient, maybe 20%, 30%, that cannot get TKI or that blocks VEGF pathway because of the risk of bleeding or portal hypertension. So I think that's one of the sort of the patient population that could potentially benefit from the combination of Tremi plus Durva. Not only that, I do think that the data with Durva as a single agent is very interesting. In the past, there has been some negative study with a single agent checkpoint inhibitor versus a TKI, such as the Checkmate study, which was negative in first line. Having said that, with this non-inferiority data with Durva therapy, showing that once again, the numbers trended much better towards Durva in terms of OS, PFS, and response rate. That if the patients are not a candidate for Atezo and Bev, and not a candidate and a potential candidate for TKI in the past. Now, with the data with this HIMALAYA study, most of us would probably maybe use Durva as a single agent in those patients instead of going with a combo. So in the patients who are not a fit for a doublet, we may now opt to go to a single agent Durva versus a TKI because of the potential side effect that you see with the TKI as well. So I think this was definitely a positive study, and it will impact their practice that some of our patients will get the combination of Tremi plus Durva in this setting in the patients who do not qualify, who are not who has contraindication to bevacizumab. Having said that, any patients who have a contraindication to immunotherapy period will still get TKI in first line. So I think there's still a role for all three different the combination or single agent. But once again, without head-to-head study, it's tough to say if one's better than the other. But I would say that still, Atezo-Bev will still be used mostly in first line just based on experience and toxicity profile. But yet there will be a role for a combination of Durva plus Tremi in first line setting.